This is a Thai TV5 program about diseases caused by arterial sclerosis with stenosis and obstruction, 17 July 2012. Subject: diseases caused by arterial sclerosis with stenosis and obstruction. Resource person: Pantipar Vashalobun, President of Biomolecular Therapy Clinic Asia; Dr. Prasit Patanapanish, MD, Director General of Biomolecular Therapy Clinic Asia. Symptoms: impaired memory, dizziness, paresis, paralysis, high blood pressure and blood vessel sclerosis, etc. All of these symptoms are caused by sclerotic blocked blood vessels. Blood vessel sclerosis in the initial stages does not have any symptoms. The symptoms first start to show after fat deposition on the walls of the large blood vessels cause a narrowing or blockage that restricts the blood flow. This condition causes too little or no blood to be available for looking after the organs. Effects on the organs from blood vessel sclerosis, stenosis and blockages. Heart. About 40% of patients with heart disease have too little blood flow to look after the heart. If the blood vessel block is acute, then this can be fatal. Other heart disease patients with blood vessel sclerosis may have symptoms of breast pain in the middle of the sternum or a pain in the neck and left arm. In addition to this, it can cause symptoms similar to indigestion, also fainting, nausea, vomiting, shock or coma. Brain. Cerebral atrophy with symptoms of arm and leg weakness and dizziness. Stenotic or occlusive stroke can cause brain tissue death with symptoms of paresis, paralysis, impaired memory, confusion or coma. A stroke of these types with a rupture of the cerebral arteries causes more severe symptoms than from a blocked artery. Kidneys. Can make the kidneys not function properly or can cause renal failure. Retina. Can cause macular degeneration and visual impairment. Can cause systolic hypertension. Can cause pain in the area of the calves, often giving cramps. Dr. Prasit Patanapanish. Arteriosclerosis is a dangerous disease of the arteries that is caused by a reaction to toxins inside the artery, and this condition can cause many infections in the body, especially in the root of a tooth. Some people think that this is not important and does not cause problems. However, sometimes it causes big problems due to toxins and pus accumulation. These issues create an immune response in the body and an inflammatory side effect in the arteries that causes increased arterial fat deposition on the arterial walls. If one eats an excessive amount of desserts, then fat will be stored in the liver and converted to sugar. Stress can make the immune system go down and cause the body to secrete more steroids. People who have diabetes and high blood pressure must get treatment to get better. If they do not get better, then one problem with this is that these conditions cause hyperlipidemia. Many organs are affected by sclerotic blood vessels. Initially, if the arteries in the brain are constricted, then this loss of blood flow can cause Alzheimer's disease. If the blood vessels are blocked, then this can cause paralysis due to cerebrovascular disease. If the heart arteries are stenosed, but not yet blocked, then this loss of blood flow in a small area can cause pain in the area of the heart, on the left-hand side under the breastbone. If the heart arteries are even more stenosed, then this can cause heart failure, causing shock, fainting, and necessitating heart bypass treatment. It is very important that the blood flow to the heart is maintained, not only for the heart but also for the kidneys, etc. If this flow is reduced, it can affect ekresis, causing the creatinine level and bone waste matter to accumulate high hydrogen products. If the artery to the retina is sclerotic and the blood flow is obstructed, or the artery may be broken, then this stops the functioning of the retina, causing blindness. This effect comes from the heart blood vessels. Pantipar Vashalobun. As we can see, this means the treatment of our blood vessels is very important, as you only need to have one very severe problem only one time and the symptoms can kill you. This is because the disease hematostenosis can cause the arteries to rupture. Some people have symptoms prior to this, however some do not. The Berlin University of Pharmacotherapy has examined the arteries of about 20,000 corpses and found that most people aged 70 had died because of arterial stenosis. This disease can also kill people of age 60 or 50 or even 40 or 30. Our patient Mr. Narong was in a coma for about 8 months due to hypertension and internal bleeding in the brainstem area. The above was found during a CT scan after his relatives took him to the hospital. It was not possible to carry out an operation, there was no convalescence, and he could only take medicine and had to use a respirator. In addition to this, he could not do anything by himself and he had to be fed through a feeding tube. Before treatment by biomolecular therapy, he can open his eyes a little bit, only wants to sleep, also sometimes can nod his head, open his eyes, move his mouth, turn his neck left and right, swallow 4 to 5 cc each time. Also, because of cough symptoms, sometimes has to be given oxygen. Treatment by biomolecular therapy. After 1 week, can breathe better, not tired, also sometimes can open the eyes and clench his fist. After 2 weeks, can do more things, i.e. can open his mouth more to eat food or drink juice about 1 to 10 teaspoons. When he is cold, he can rotate his neck left or right. When he wakes up, he opens his eyes and can watch TV. He knows more things and can nod his head when answering questions. After 3 weeks, can now clench his fist and make his arm tense. Also his legs are stronger. And when using acupressure on his feet, he feels pain and jolts his leg back. In addition to this, he can open his mouth wider when eating food and can also eat 6 to 10 teaspoons of food each time, similar to chewing. After 5 weeks, he is awake all day with his eyes open. After 4 months, does not need to use the neck support collar and can sit up 3 to 4 hours 3 times a day. He can also open his eyes all the time and go outside without having to take an ambulance. After 5 months, can defecate normal without straining. We use extracts to gently restore all blood vessels, giving them more elasticity and quality for all organs and tissue, including bones, muscles, skin, hair, etc. Loose, drooping skin can be more firm. Our patient Mrs. Summerly's heart arteries became more enlarged and elastic, also her other arteries that were not stenosed. We can restore all organs using the cell-heal-cell concept. The blood vessels have a very important role, like a main road, including the capillaries, for providing nourishment and for looking after all organs and tissue. We can restore the blood vessels to make them more elastic. Contact details. Please contact us for more information or if you would like a consultation and help regarding your own health problems at email vitorganinfo@gmail.com. Vitorganinfo, one word spelled VITORGANINFO. Phone +66 outside Thailand 86 386 8822 or +66 287 409 80 or +66 865 09 6666. Fax +66 287 409 85. Our address: Biomolecular Therapy Clinic, 30/8 Mu 1, Mu spelled MOO, Soi Puthabusha 5, Soi spelled SOI, Puthabusha spelled PUTHABUCHA, Puthabusha Road, Bangmut, Jom Tong, Bangmut spelled BANGMOD, Jomtong, spelled Jomthong, Bangkok 10150, Thailand. We also have a website, worldwideweb.biotherapycenter.com. Biotherapy Center in one word, spelled BIOTHERAPYCENTER. We look forward to hearing from you and helping you. Thank you.